We're going to be doing skill number 13 now. This is measure and record urinary output. This skill is done at a station, so you will not have a patient to greet and identify. You will not need to do all of your pre- and post-procedure actions that you have been doing. So we need a pair of gloves when we do this skill. The station will be set up with a bedpan and the measuring container. So I'm going to begin by putting on my gloves. I've got my measuring container. I'm going to get my bedpan, which some nurse evaluators may put food color in this to make it yellow to resemble urine. Today we just have water. And I poured it into the measuring container without spilling or splashing. So if I did accidentally spill or splash, remember you can always tell your nurse evaluator, I would not have done that. I would not have spilled or splashed the urine. Now I've got to measure it at eye level on a flat surface. So I get low and I see that it is 175 milliliters. Remember that when we use a measuring container, we will always use the milliliter side, not the ounces side. We will always use the big numbers, not the small numbers. We will document this in milliliters or cc's, not ounces. So 150 milliliters. Is that what I said? Let me look at it again. Oh, 175 milliliters. So now I'm ready to take care of this. I'm going to dump this into the toilet. I'm going to get my rinse water. My rinse water is going to go into the toilet as well. I'm going to put it in the designated dirty supply area. I'm going to get my bedpan, my rinse water. I'm going to pour my rinse water into the toilet, put this in the designated dirty supply area. I'm going to remove my gloves and wash my hands. Remove my gloves into waste container without contaminating self. Wash hands. And that is the conclusion. After I wash hands, I'm going to record. So we're going to write down 175. And that concludes the measure urine output skill.